The Health Minister has promised an extensive review of the healthcare financing system, saying it will involve fundamental shifts. Mr. Gan Kim Yong says the review will likely take more than a year. He also announced plans to build more hospitals and polyclinics to cater to the country's aging and growing population.
It will be a comprehensive review to address the concerns many Singaporeans have expressed about rising healthcare costs. This includes just how much out-of-pocket cash do you have to pay when you visit a doctor? And what happens if you incur large hospital bills?
There is strong desire among Singaporeans for greater peace of mind. The assurance that I will be able to afford healthcare when family and I need it, whether now or when I grow old. We take these concerns to heart. We want Singaporeans to be confident that they can always afford the care that they need. Part of this involves managing costs in our system.
So the first major shift, the government will increase its share of national spending on healthcare from the current 1/3 to about 40% and possibly even more. The aim is to reduce the impact of rising healthcare costs, especially for the lower and middle income groups. 2. Further expanding coverage for MediSave, the National Medical Savings Scheme.
How do we prioritize the different needs to ensure that MediSave will not be depleted prematurely? How do we ensure that providers focus on the necessary and cost-effective treatments so that each MediSave dollar is well spent?
3. Stretching the dollar and enhancing the role of national medical insurance schemes. For example, looking at whether the cap for MediShield, designed to cover catastrophic illnesses, should be raised to offset a higher proportion of large hospital bills.
We will study how we can shift the balance towards greater insurance coverage without driving up demand and consumption, and allow insurance to carry a larger share of healthcare funding.
And while the review is underway, Mr. Gan announced a slew of measures to help needy Singaporeans. This includes expanding the list of subsidized drugs and doing away with the $3 transaction fee imposed on patients who make MediSave claims. And while the government is looking at ways to make healthcare costs more affordable, Mr. Gan stressed that the principle of co-payment remains because the starting point is for every Singaporean to take care of his or her own health. Separately, the government will ramp up infrastructure on healthcare in anticipation of an aging and growing population. Mr. Gan said there may be a need to build 4 more new acute hospitals in the next decade.
We are currently studying regional demographic profiles to identify potential locations for these new hospitals, and we will review our infrastructure plans nearer 2020.
There are currently 7 public acute hospitals in Singapore. And in regions where there are gaps in coverage, Mr. Gan announced plans for new polyclinics. First up in 2 new towns, Jurong West near Pioneer and Punggol. These will be ready by 2017. By end 2020, Mr. Gan said there may be 4 more polyclinics needed and another 6 or 8 more by 2030.